Pain relief versus healing. Can painkillers affect recovery? A Porter Ranch chiropractor explains. By Dr. Masoud Shamaeizadeh, DC, Soft Touch Chiropractic, Porter Ranch and Northridge, California. When you're hurting, naturally you want the pain to stop. For many people, the first response to back pain, neck pain, a sprain, muscle injury, or joint pain is to reach for a pain-relieving medication. And there are certainly situations where medication can be appropriate and helpful. But there is an important distinction that every patient should understand. Reducing pain and completing the healing process are not necessarily the same thing. Pain relief describes how you feel. Healing describes what your body is actually doing to repair injured or irritated tissues and restore function. Understanding that difference can change the way we think about recovery. What does healing actually mean? When tissue is injured, the body begins a coordinated biological repair process. Depending on the type and severity of injury, this process can involve inflammation, removal of damaged cellular material, formation of new tissue, remodeling of collagen and connective tissue, restoration of strength, gradual return of movement and function. Think about a broken bone. A physician may stabilize the fracture with a cast, brace, or other treatment, but the cast itself does not manufacture new bone. The body performs the biological repair. Over time, new tissue develops and remodels until the injured area becomes stronger. This illustrates an important principle. Feeling better does not always mean healing is complete. Pain is a signal. Pain is one of the body's protective warning systems. When tissue is irritated or injured, sensory information travels through the nervous system and is processed by the brain. Pain may encourage you to stop an activity, protect an injured area, change the way you move, seek professional evaluation, avoid additional injury. However, pain is complicated. The amount of pain someone experiences does not always correspond directly to the amount of tissue damage. That is why persistent or severe pain should be properly evaluated, rather than simply ignored, or automatically assumed to represent serious damage. What do painkillers actually do? Different pain medications work in different ways. Some primarily change the way pain is perceived. Others, such as non-steroidal anti-inflammatory drugs, NSAIDs, can reduce both pain and inflammation. Common NSAIDs include medications such as ibuprofen and naproxen. These medications can be very useful when appropriately selected. However, like all medications, they have benefits, limitations, and potential risks. The key question should not be, are painkillers good or bad? A better question is this medication appropriate for this patient, this condition, this dose, and this length of time? Can NSAIDs slow healing? This is where the science becomes particularly interesting. Inflammation is often viewed as something completely negative. But inflammation is also part of the body's normal response to injury. Researchers have therefore investigated whether medications that reduce inflammation could influence certain aspects of tissue healing. The answer is not simply yes or no. Research on NSAIDs and bone healing has produced mixed results, and factors such as dosage, duration of use, type of injury, age, and the specific medication appear to matter. Some research suggests that higher dose or prolonged NSAID use may deserve greater caution in certain bone healing situations, while short-term use appears less concerning. Read the scientific research on NSAIDs and bone healing through PubMed. This is why patients should not stop prescribed medication based on something they read online. Medication decisions should be discussed with the healthcare professional who prescribed or recommended the medication. Pain relief can sometimes create a false sense of recovery. There is another important issue that has less to do with the medication itself and more to do with behavior. Imagine that you strain your lower back. It hurts to bend, lift, or twist. You take medication, and several hours later you feel significantly better. You may naturally think, "I'm healed." But the underlying tissue may still be recovering. If pain relief causes someone to return too quickly to heavy lifting, strenuous exercise, sports, or repetitive activity, the recovering area may be exposed to more stress than it is ready to tolerate. That does not mean pain medication is harmful. It means pain relief should not automatically be interpreted as complete tissue recovery. The nervous system and pain. The nervous system plays an essential role in both pain perception and movement. Your brain, spinal cord, and peripheral nerves continually receive information from muscles, joints, skin, and other tissues. This information helps the body coordinate movement, balance, muscle activity, protective responses, sensation, motor control. This is one reason a proper musculoskeletal examination is important when pain continues. Instead of focusing only on how much something hurts, we can also evaluate how the area moves and functions. Where does chiropractic care fit? Chiropractic care should not be presented as a replacement for every medication or medical treatment. Instead, chiropractic care is one of several non-pharmacologic approaches that may be appropriate for certain musculoskeletal conditions. According to the CDC, non-pharmacologic approaches can play an important role in pain management, particularly for subacute and chronic pain. These approaches can include exercise, manual therapies, massage, acupuncture, mindfulness-based approaches, and spinal manipulation. Read the CDC's information on non-opioid therapies for pain. At Soft Touch Chiropractic in Porter Ranch, our goal is to evaluate the physical and mechanical factors that may be contributing to a patient's symptoms. Depending on the individual patient, this may include evaluating joint mobility, spinal movement, muscle tightness, muscle imbalance, posture, range of motion, functional movement, areas of tenderness or irritation. Treatment is then selected according to the patient's condition and examination findings. Chiropractic care for back and neck pain. Research suggests that spinal manipulation may provide modest improvements for some people with acute or chronic low back pain, and it may also be helpful for certain types of neck pain. Learn about spinal manipulation and pain from the National Centre for Complementary and Integrative Health. Depending on the patient's needs, care may also include other conservative approaches designed to improve movement and function. The goal is not simply make the pain disappear. We also ask, why is this area painful? How is it functioning? And what can we do to safely improve movement and function? Pain relief and healing should work together. This is the central message I want patients to remember. Pain relief is important. Nobody should be expected to suffer unnecessarily. But reducing pain is only one part of recovery. A more complete approach may consider pain relief plus proper diagnosis, plus movement plus function plus rehabilitation, plus time equals better recovery. Sometimes medication is part of that process. Sometimes chiropractic care, exercise, rehabilitation, or another conservative treatment may also be appropriate. And sometimes medical treatment is necessary. The goal should be to choose the right combination for the individual patient. When pain needs medical attention. Not every painful condition should be treated conservatively without further evaluation. Seek appropriate medical attention for symptoms such as severe or rapidly worsening pain, significant trauma, new or progressive muscle weakness, loss of bowel or bladder control, numbness in the groin or saddle region, fever associated with severe back pain, unexplained weight loss, chest pain, difficulty breathing, symptoms suggesting fracture, infection, or another serious condition. A good healthcare provider should know not only when to treat, but also when to refer. Looking for a chiropractor in Porter Ranch or Northridge? If you're experiencing persistent back pain, neck pain, muscle tightness, stiffness, reduced mobility, or other musculoskeletal discomfort, consider having the problem properly evaluated. At Soft Touch Chiropractic, we focus on understanding both your symptoms and the physical factors that may be contributing to them. Our philosophy is simple. Don't only ask, "How can I stop the pain?" Also ask, "Why am I hurting? How is the area functioning? And what can I do to recover properly?" Learn more about Soft Touch Chiropractic. Contact Soft Touch Chiropractic to schedule an evaluation. Soft Touch Chiropractic, Dr. Masoud Shamaeizadeh, DC. Porter Ranch/Northridge, California. 818-831-0100. This article is for educational purposes only and is not intended to diagnose a condition or replace individualized medical advice. Do not stop or change prescribed medication without discussing it with the prescribing healthcare professional.